Good morning, everyone. I'm Jonathan,
I'm Colby.
and we are here with Apex Counseling. We're doing another episode of Reddit Set Go, where we read off questions from Reddit that people have asked regarding mental health and give an actual licensed therapist's take on it. All right, so I need surgery. Nothing life-threatening, but my doctor says if I keep putting it off, it could turn into something much worse. The procedure itself doesn't scare me. What terrifies me is the anesthesia. I've read every horror story about people waking up in the middle of the surgery, feeling everything, or not waking up at all. It's gotten to the point where I've canceled the surgery twice. I know this isn't rational, but the thought of surrendering control and having my consciousness shut off makes my chest tighten. I feel trapped between letting the problem get worse or facing what feels like my ultimate nightmare. What do you think?
Well, one, this individual should stop listening to the horror stories. They're probably seeking it out. They're probably finding Facebook pages or websites where people are sharing, where everyone's sharing their horrific story of being put under. And that's just not helping, because that's making it seem like it's happening all the time, when in reality, issues do happen, but they're actually probably pretty rare. And so I would recommend that somebody just talk to other people, talk to friends, family who have had to be put under for a surgery, because I imagine they don't all have horror stories.
Yeah, start collecting the stories of where it went well, where somebody went to sleep and then woke up and that was the entire experience. Okay.
Because being put under is never comfortable. It's an odd experience. So it's natural that most people would have a little bit of anxiety about it. Also, it sounded like they had a bunch of questions in there. Talk to your doctor if you have questions. If you have concerns about what the anesthesia is going to be like, maybe you have a history in your family where people have woken up during anesthesia and it hasn't had the same impact. Ask your doctor about that. Talk about those concerns. I'm sure they're going to be able to give you an answer.
Yeah, because I think in a lot of cases you meet with your anesthesiologist prior to a surgery. I know when I had to go under anesthesia, I met the actual anesthesiologist and they said, do you have any questions? And I had no questions. I was like, no, why are we even meeting? But in this case, it sounds like the person has a ton of questions that would be wonderful to have answered.
And that'd be a great opportunity to ask them.
Okay. Yeah, and so it sounds like the advice would be focus on basically, like, what are the real odds of this happening? Like, when you buy a lottery ticket, you think you're going to win the lottery, but, I mean, realistically, you buy a ticket and nothing happens.
Yeah.
And in this case, I mean, I'm sure anesthesia has really good odds of that, like, nothing's going to happen. It would be my guess. I've not looked it up, but...
Yeah, just balance the narrative.
Yeah.
There are horror stories out there, but there's way more really just benign stories of, like you said, I went to sleep and I woke up.
Yeah. Fantastic. Let's check the next one. Needles at the doctor's office. I have 2 full sleeves and sat through 4-hour tattoo sessions without a flinch. But put me in a doctor's chair with a nurse holding a syringe and my hands sweat, my heart races, and I feel like I'm about to pass out. I don't understand why the exact same object can feel totally different in a medical setting.
That's a good one. So many times we view those as like, oh, a needle's a needle, whether it's a tattoo or an injection. Actually, those two are very different. I don't have a tattoo, but my understanding of a tattoo gun is there's not this just long singular needle sticking out.
The needle's like that big.
You hardly see it. It's not going to be as intimidating as somebody pulling out a syringe with a really long needle. And so they're probably very different. Plus, it's a very different sensation, getting an injection versus getting a tattoo. Tattoo feels a lot more like scratching, where injection, that needle's going pretty deep because it's supposed to. So it makes sense that you would feel that somebody might feel a little bit more anxiety when it comes to an injection.
I wonder if the environment matters too, because I don't. If you don't have a tattoo, you've never been in a tattoo shop.
Yeah.
I have, and I mean, this is a pretty relaxed atmosphere, like just kind of hanging out and whatever. And then the medical setting is so formal, and I mean, they even have thing called white coat syndrome, where people get anxious in the medical setting. So I have to imagine that might be playing a role here too.
Absolutely. The setting is probably going to create a difference. You're sitting in an exam room where there's like a sharps container. Maybe they even have a few syringes laid out on the table. You're right. It's very sterile. It's not warm and comforting and relaxed.
Yeah. Okay. So if we were going to invite a person to help themselves, is there anything they can do to help themselves without having to go to, phobia therapy to get some assistance?
I mean, for people that have a fear of an injection, things I'm always recommending outside of therapy and working on a needle phobia, practice deep breathing. Tell your doctor about it. If you have a fear of needles, let the nurses know. Mm-hmm. They can work with you if they know that you are experiencing a lot of fear in the moment.
Yeah, because this is pretty common, right? Like needle phobia is not like so nurses and doctors should know how to deal with this, right? Like, okay, because this is not a 1 in 10,000 situation. Okay,
no,
I didn't think
it's
so.
like a fourth of people.
Oh, okay, yeah.
It's a needle phobia.
So a nurse in their second week on the job has already seen this a dozen times.
Probably.
Yeah, okay.
Yeah. And so just telling your provider about it, as well as if you know that maybe you have a tendency to pass out, mm-hmm. because that's very common to experience a vasovagal response. Mm-hmm. If you have a needle phobia, make sure you're lying down.
Yep.
It's okay if you pass out. It's unpleasant, but nothing wrong is going on. Yeah. So if you know that you have a tendency to pass out, let your provider know. Make sure you're lying down, so that way if you do pass out, you're not going to hurt yourself by falling.
Yep. Fantastic. All right, last one. Oh, this is a long one. Okay. I'm probably going to summarize this. I'm probably not going to read this gigantic thing.
Okay.
Somewhat famous case here. Somebody's asking a question about Gypsy Rose Blanchard, which was a Munchhausen's by proxy situation. So after watching the documentary about Gypsy Rose, I can't stop thinking about how my mom used to push for medical tests, treatments, appointments when I was a kid. Looking back, I'm not even sure some of them were necessary, things like repeated blood work, specialist visits, etc. I've been wondering, in Gypsy's case, we know her mom had Munchausen by proxy. How much of that is intentional manipulation and how much of that is a person actually believing they're helping? I'm not saying my situation was anywhere near as extreme, but it's made me question whether there's a more subtle version of this, one where the parent convinces themselves they're being helpful. That's an interesting question.
That's a hard one to answer because Munchausen by proxy is very complex and
rare enough that it's hard to study. Like that's a tricky case to study.
Yeah, it's not. It doesn't occur super frequently. And there may be things, a parent who has anxiety, that are going to do some things that resemble Munchausen, but it's also not. I mean, Munchausen's is kind of this very extreme version of it.
Yeah. Basically where the parent gains attention by continually having their child go through those kind of things, yeah.
Yep, you're gaining attention, you're kind of creating dependence. A child's depending on you. And all of that may be fueled by anxiety, but it's just at such an extreme level where at a more everyday level, sure, a parent who is maybe overly anxious and worried about their child's health, are they maybe going to take their kids to the doctor a little more frequently? Probably. Does that also mean they might be subjected to some additional tests and blood draws and any kind of medical procedure that maybe they normally wouldn't have? Probably. Is that the parent intentionally trying to harm their kid by putting them through more medical procedures? No. That's just a parent's anxiety. And so they're going to seek out reassurance by engaging in as much medical care as they can in order to help their child.
There's another thing I'd be curious about here. Of course, I can't ask the person who posted this question, but it makes me wonder, there's a thing people have a tendency to do, which is to ask what I call ineffective questions. Because it sounds like the implied question here is, why did my parents do what they did? And a thing I often ask people is like, why is that part important to know? Are you trying to decide if you're mad at your parents, or because a lot of times it's really about solving what was the effect on it. And a lot of times, finding out why did they do it is not super helpful to figuring out how to deal with the aftermath of my parents' medical anxiety or Munchausen's or whatever it was.
Yeah.
So I think one of the things I would also be asking this person is, are you sure this is an effective question? Or, is it really all that important to try and diagnose whether your parents had Munchausen's or whether it was intentional or whether it was anxiety? So I think I'd be asking that question too. And sadly, of course, in this format, I can't. But
yeah. And another big distinguishing factor from just general, like, unmitigated anxiety versus Munchausen's is usually with Munchausen's, the parent is making up disorders.
Right. Versus anxiety, they think it's happening.
They think it's happening,
Yeah.
and they're probably going to be reassured by doctors who say, no, it's not. Whereas with Munchausen's, and if I remember Gypsy Rose Blanchard's case a little bit, like, I think she was undergoing treatment for cancer when maybe she didn't have it.
Oh gosh, okay.
And her mother was...
I have not seen the documentary, so I don't...
Yeah, I think, if I remember it correctly, her mother was kind of falsifying medical documents and kind of making it seem like her health conditions were way worse than they actually were. She might have had some things, but it wasn't at the extent that the mom said it was.
Gotcha. Okay.
So that's also a big difference.
All right. Well, thanks a bunch, Colby, for answering some of those questions. So this has been the Colby edition of Reddit Set Go, and we will see you next time.